before we get into the details, I really want you to have a good understanding of what the autonomic nervous system is. So think about two different scenarios here. The first scenario is probably Thanksgiving dinner. You had a large meal, you're sitting in front of your TV, you're relaxed, your guard is down, right? You're not physically exerted. You are probably tired, sleepy, less light is coming into your pupils, right? Blood is being shunted away from your skeletal muscles and towards your GI organs, your stomach, your colon, right? Your glands, such as your liver, glands of your mouth, are increasing their secretions to help break down that large meal that you just had. And so in this state, you're resting and digesting. Okay, there are no external threats, right? There's less light coming into the pupils because they've constricted. And this is the state of your body under the influence of the parasympathetic system, okay? Rest and digest. Think about an alternate scenario. You're being chased by a bear or a tiger or some vicious animal, and you're fleeing for your life, okay? Blood is being shunted in the opposite way, right? From your GI organs, because you're not trying to digest food at that time, to your skeletal muscles to help you flee or freeze, okay? Light is coming into the eyes, the pupils dilate to help light come in, your glandular secretions are gonna stop, but your sweat gland secretions are going to increase. Think about being nervous or being excited, that reaction that you get. Palms are sweaty, armpits or axilla become sweaty because of the excitation of those glands, those sweat glands. This is the influence of the sympathetic nervous system, okay? Now understand that although these two evil twin brothers, as I like to call them, are very different, very opposite ends of the spectrum, in order for our body to exist in homeostasis, both of them must sort of hold hands in the middle, okay? Neither of them can out-influence, for the most part, the other. They must meet sort of at this happy medium in the middle, and that is how we establish homeostasis, okay? So there are two divisions of the autonomic nervous system: sympathetic, which is responsible for fighting, fleeing, or freezing, and then parasympathetic, which is responsible for resting and digesting or recuperating, okay? And so they operate in what we call comparative secrecy, where they're trying to outdo each other, but they never really do, okay? They end up striving for this perfect balance where they both are active. Now, if we have, for example, a situation of over-influence of the parasympathetic system, okay, this is where things slow down too drastically. Understand that if we don't have the sympathetic balancing out the parasympathetic system, we get into disease process. We throw off homeostasis, and this is the beginning of disease, okay? So it manages a multitude of unconscious processes. Again, I mentioned some of them, but there are a whole bunch more, which include reproductive function, the sexual cycle, and things like that. And it's really important for homeostasis. We cannot exhibit or maintain homeostasis without the autonomic nervous system. Very, very important. Okay. Now, the anatomy of the autonomic nervous system is a little bit confusing, so I'll try to explain it here in a big picture way, and then we'll sort of zoom in and fill in the parts as we go. So there are two divisions here, and this is a schematic representation showing you the sympathetic system on the left and the parasympathetic system on the right. Now, understand here that all the organs, all the effector organs that we're going to speak about are the exact same for both of these divisions of the nervous system, okay? And they're shown here in the middle. Our pupils, our lungs, heart, our GI organs, bladder, genitalia. These are all under the influence of both of these systems, okay? Now, on the left, the sympathetic system is controlled where these fibers arise from T1 to L2 of the spinal cord. So the sympathetic fibers arise from this segment of the spinal cord. Okay, make sure that you're connecting this to the anatomy of the spinal cord, the anatomy of the vertebral column. We know that those spinal nerves are exiting at every level. The ones that exit from T1 to L2, they are responsible for sympathetic innervation. Likewise, or alternatively, on the parasympathetic side, the fibers that are controlling parasympathetic innervation do not come from along the spinal cord. Instead, there are 4 of our cranial nerves, cranial nerve 3, 7, 9, and 10, and 3 of our pelvic nerves here, okay, S2, S3, S4. Alrighty? So cranial nerve 3, 7, 9, 10, S2, S3, S4, these craniosacral segments, right, of the spinal cord are responsible for parasympathetic innervation. Now, it's also important to point out here, and I'll continue to stress this again, that in the sympathetic nervous system, we have shorter preganglionic neurons. Now, communicating from the spinal cord or cranial nerves to that effector organ, there are 2 neurons that are interacting with each other, that are relaying the signal. One is called a preganglionic neuron, the other one is called a postganglionic neuron. And I'll talk about that in a minute, but I really want to point out here the difference in the length between these neurons. So in the sympathetic system, we have a short neuron and the ganglia is very close to the spinal cord, whereas in the parasympathetic system, the ganglia are further away from the spinal cord and we have a short postganglionic neuron. Okay, so let's see what that looks like here a little bit up close. Any questions so far? Any questions so far? Okay, so we're speaking about the anatomy of the autonomic nervous system. Okay. And I'm going to distinguish the sympathetic system up here from the parasympathetic down here. Okay. Now, when we take a cross section of the spinal cord, this is something like what we see, or this is kind of what we see here. There's a dorsal column here, a lateral horn, a ventral horn. Likewise, again, there's a dorsal horn, a lateral horn, a ventral horn. Okay, and so let's just label these out. So this is the dorsal horn. Okay, this is our ventral horn. And this is the lateral horn. Bear this in mind because we're going to keep talking about these different parts of this cross section, okay? All right, now in the sympathetic system, we have a short preganglionic neuron and a long postganglionic neuron. I'm sorry, guys, this is supposed to be sympathetic. Please forgive me. So this is going here, sympathetic short. This one's long. This should be the opposite. Okay. Okay, so you got a short preganglionic, a long postganglionic, and then down here we have a long preganglionic and a short postganglionic. Now these words ganglionic may sound weird or strange. Let's describe what a ganglia is. Now, if you remember, I keep mentioning that the central nervous system is brain and spinal cord, and then everything else is peripheral nervous system, except for these areas where we have cell bodies outside of the central nervous system. So let's make this distinction here, that this is central nervous system and this is peripheral nervous system. Now, anytime we have a cell body, such as here, a soma, that exist outside of the central nervous system. We call it a ganglia, okay? So cell bodies outside of the CNS are called ganglia. Now, the ones that control the autonomic nervous system are called autonomic ganglia. Okay? And so the autonomic ganglia is the area where the preganglionic neuron synapses onto the postganglionic neuron. Okay? Now, we want to understand here that the fibers that arise from the autonomic nervous system arise specifically from the lateral horn. We'll talk about other fibers that arise from dorsal and ventral, but these fibers are coming specifically from the lateral horn. This is also called the intermediolateral cell column. Okay, and for your purposes, those two areas are interchangeable. So the fibers that are controlling both sympathetic and parasympathetic come specifically from the lateral horn. Okay, we'll talk about how those fibers look differently for each of these systems. But the main point here is that fibers come from the lateral horn. In the sympathetic system, they come from T1 to L2. Okay, so just that segment of the spinal cord, whereas in the parasympathetic system, they come from cranial nerves 3, 7, 9, and 10, and S2 to S4. Oops. Okay, cranial nerve 3, 7, 9, 10, S2 to S4. Okay, let's talk about what the effector tissues that these neurons, these autonomic nerves will innervate. All right, so our effector tissues are over here. And these can be cardiac muscle. These can be smooth muscle. These can be glandular tissue. Or in this case of the sympathetic nervous system, these can be adipose. Okay, or fat tissue. So the types of tissues that these affect: cardiac muscle, smooth muscle, glands, and adipose. And those were all those organs that were in the middle of that schematic diagram. All right, the skeleton, the smooth muscle of the iris of the eyes, the smooth muscle of the GI tract, the smooth muscle of the bronchial airways of the lungs. Okay, these are the target tissues of the autonomic nervous system. So no skeletal muscle, right? Skeletal muscle is voluntarily controlled. So the affected tissues here will not include skeletal muscle, okay? Glands, adipose, cardiac muscle, smooth muscle.